Hi, I'm Dr. Sinagra, and I want to talk to you a little bit about rheumatoid arthritis. One of the main things that you must understand as a rheumatoid arthritis sufferer is you don't have a joint problem. That is the biggest key in dealing with rheumatoid arthritis. A lot of people are like, what do you mean I don't have a joint problem, Doc? Yes, I do. My joints are swollen, I have pain. No, you have an autoimmune problem. And this is what the difference between our approach and the standard medical approach. We're going to look at you like an autoimmune patient. We're also going to look at you globally. What that means is I'm not going to look at you like a lab test or a lab finding. I'm going to look at you like Mary or Pete. You're a person. You have to look at someone globally to really understand what's going on with rheumatoid arthritis. When dealing with any autoimmunity, they're not unknown cause. Medicine will tell us that they're idiopathic, their cause is not known. It's not true. What we have found, it's a breakdown in multiple systems. And the first thing is food allergies, food sensitivities. Number one, your body is invaded every day by what substance the most? Food, water, and air. So if you're eating a food that you're allergic to or sensitive to, what happens to your body? Your immune system reacts to that food like it's an invader, and it throws your immune system into hyperdrive. The resulting factor is your joints are the victim, not the problem. This is why you can take all those medications and you never get better, because you have to find the cause. The second thing is something called dysbiosis. A high percentage, over 70% of people with rheumatoid arthritis have what we call silent infections. They've had prior, or they still have, infections in their digestive tract or their body, and your immune system is reacting to that infection. Or like we used to say, even if you kill the infection's like a hammer. You break a window, you remove the hammer. The window's still broken. The compounds that are formed and the complexes that are formed by silent infections in your immune system can linger in the joints for months and years. So this is a really, really powerful way of calming down your immune system. It's cleaning up the digestive tract with dysbiosis. Dysbiosis is an overgrowth of bacteria. If that overgrowth of bacteria is not corrected and cleaned out, it'll be a constant source of an immune system antigen or an immune system trigger. The third thing is xenobots. Xenobots or xenobiotic toxins are fertilizers, solvents, chemicals, heavy metals. These things actually, when they enter the body, your immune system has to deal with these, and they tend to linger. If you have a heavy metal burden, or you have a toxic buildup of solvents, chemicals, fertilizers, pesticides, your immune system is going crazy dealing with these things. Again, the subsequent side effect is they go after your joints because the immune system is malfunctioning. The fourth and final thing is hormones. If you are dealing with hormone imbalances, that can cause your immune system to really, really overreact. We have found that DHEA, cortisol, testosterone, prolactin, estrogen, all these hormones must be tested. And if we find imbalances, there are natural ways we can bring your body's hormonal levels back into balance. The whole thing is about restoring proper function. My partner, Dr. Weinstein, is going to come on. He's going to give you a little bit more understanding of what we do exactly when dealing with an autoimmune patient, especially a rheumatoid arthritis sufferer. Thank you.
We understand that you have a genetic predisposition to rheumatoid arthritis. But what we also understand is it requires some type of trigger mechanism for it to come out as a disease entity in you. And the goal in our office is to get your body to function better by figuring out what is tripping your immune system. So through specialized lab testing, looking at blood sugar, as Dr. Sinagra said, adrenal function, looking for active antigens, if we can figure out what's tripping your immune system through diet, supplementation, detoxification, we can help you get healthy. Secondly, we have a neurologic approach. As a rheumatoid patient, you probably understand that your spine is being severely affected by rheumatoid arthritis, both in the upper neck and in the sacroiliac joints. We have a neurologic approach to treating the upper cervical area that is unbelievable. Now, the upper cervical area also controls body function. The brain has got to be able to communicate with all systems in the body for you to be healthy. we have an upper cervical approach to treating this area. Secondly, we look at sacroiliac joints because we know as a rheumatoid arthritis patient, it's affecting those joints, and through chiropractic techniques, of course, we could be helpful. So the real key to coming into our office is understanding that you've got to increase body function, both metabolically and neurologically, and that is exactly what we do, and our patients do great. You know, I hope to see you in the office. We'd like to help you. Feel free to call us for a consultation. Thank you very much.